Hi, welcome to the second session of the pelvic pain group. Today we're going to chat about what exactly pain is and then more specifically about pelvic pain. Our objectives for today are to learn about pain, learn about pelvic pain, and get to know the pelvis and its functions. And we're also going to start understanding what self-management means. So what exactly is pain? Well, first of all, pain is whatever you say it is. No one else is living in your body, so no one else knows exactly what you're experiencing. And we say that pain is a sensory and emotional experience. Now, when we talk about pain being sensory, it means that it's something that we feel. For some people, pain is stabbing, throbbing, aching, but pain is emotional as well, and pain has a huge impact on our mood. Pain is a protective mechanism we have that tells us to do something to protect ourselves. It's a very complex thing. It can start for different reasons. Sometimes it starts because of tissue damage or a medical condition, but sometimes there's no obvious reason, which can make pain a very frustrating and stressful experience. So what do we know about pain? Well, we know that pain is common. 1 in every 5 people have chronic pain. Now think about this. That means 1 in every 5 people we see on the street, at the grocery store, or in public transit have pain. So pain is common, but it's invisible. We can't see pain. We can't see what someone's experiencing just by looking at them. So often we feel alone when we're experiencing pain, but there are a lot of people around us experiencing something similar. We hope that by participating in a group like this one, that we can start to establish a sense of community, that maybe some of you will even meet others who are going through something similar. So the first thing we'd like to say about pain is that pain is normal. It's an important part of the body's warning system. Pain doesn't always mean that there's damage to the body. And actually, many things can hurt and not do any harm. So a good example of this would be something like brain freeze or an ice cream headache. They're painful, they hurt, but they're not actually causing damage to our brain. And the other thing that's interesting to note is that the throat is the part that's being exposed to something cold, but we feel the pain up on our foreheads. So it doesn't really make sense with what we're experiencing. Now, on the other side, sometimes people can have a lot of damage without actually having any pain. I like to chat about the young surfer named Bethany Hamilton. Some of you may have heard of her before. So when she was about 13 years old, she was out surfing and she felt jiggle jiggle bump. And what had happened is a shark had bitten off her arm. Now she didn't feel any pain. All she felt was that jiggle jiggle bump. And so because her brain is involved in processing and producing pain, her brain was able to decide that in that moment, the bigger threat was not the fact that she lost her arm. The bigger threat was that she actually needed to get to shore to survive. So she didn't experience any pain until she was in a safer situation. One of the ways our bodies determine if there is threat is by using what we sometimes call our danger sensors. So they're actually called nociceptors, and they give our brain information about 3 different types of stimulus. So the first one is mechanical. So that can be movement, that can be pressure, that can be a change in our position. The second one is thermal, so that would be the extremes of hot or cold. And chemical would be something like lactic acid after exercise, or infection or inflammation would be a chemical stimulus as well. And so we like to show this slide because it gives us an idea of how many parts of the brain are involved in processing and producing pain. Pain is extremely complex and it doesn't occur in just one part of the brain. Okay, so we have this information that comes from the body. It travels to the spinal cord and then from the spinal cord up to the brain. So just like we saw in the previous slide, many parts of the brain are involved and used to interpret this information. So the sensory cortex is where we have sort of like our body map, and it's going to look at where is this happening in my body? What's the depth? What's the pressure? Have I moved? What's the intensity of it? And then the brain's going to consult on past experience or memories, and it's going to ask, have I faced this before, and what happened last time? Was I okay? Did I almost die? Did I suffer? Or was it fine? And it's going to use this to gauge how dangerous the current information or situation is. And then the brain is going to go, okay, what is my current situation? Am I in danger? Am I safe? Am I happy? Am I sad? Am I stressed? Do I feel supported? Do I feel alone? And the brain is going to use all of this information to determine if what's going on in the body is dangerous, if it's threatening. If the brain decides, yes, this is dangerous, it turns on that pain alarm. So it uses pain to tell us, pay attention, something's happening here. And the brain is going to decide what needs to be done next to protect us. So the important thing to note is we only experience pain when the brain decides protection is necessary. And context makes a difference as well. So imagine that you're walking through the forest and you get quite scraped up on some thorns. It's going to hurt, right? Now imagine that you're running through that same forest, running away from a tiger, and you scrape your arm on those same thorns. Is it the same? Do you think you would feel it in the same way? You may not, because the brain has decided that the more important threat is the tiger, and the better way to protect is not to turn on those pain alarms, but to get you away from the tiger. So the brain uses context to decide how threatening something is. So we can compare our pain as our internal alarm. It's our brain's alarm for perceived threat. And what happens is the longer the alarm is turned on, the more sensitive it becomes over time. And it can almost become like a fire alarm that's going off all the time. So sometimes there's a reason for the alarm to go off, and sometimes there isn't. We can compare it to those very sensitive fire alarms that we sometimes have in the home that start going off even when the toaster is being used. And we know the toaster is not causing a risk of a true fire in the house, but the fire alarm has just become sensitive over time. Now, neuroplasticity is a word some of you may have heard before. Neuro means the nervous system, and plasticity means that it can change. So this tells us that the nervous system can change. Now this is great news because when I was in school, we were taught that your brain and your nervous system changes to about the age of 25 and then you're toast. That's what you've got for the rest of your life. Now we know that's not true. So we know that when we use parts of our nervous system or certain pathways in our nervous system, they become stronger. So it takes less effort and energy to use a well-established path. And that can happen with pain. So the longer we experience pain, the better our nervous system is at producing pain. But the good thing is our nervous system can change. And just like it changed towards perhaps being good at producing pain, we can help it change in the other direction. And what does that look like? So a nice analogy we like to use for neuroplasticity is imagine that you're walking through the forest on a well-worn and a well-groomed path. It's easy, smooth going, there's no rocks, no uneven ground. That's the path we are on right now. Now we could cut through the bush. It's going to be hard. We might get scraped by branches, it's going to be slow, but if we stick to it, eventually it will become a well-worn path. And the old path will actually start to overgrow and become a more challenging path. So this is a bit like neuroplasticity. And what's the most difficult part of creating a new path? Well, it's the beginning. That first time in the new path is going to be the hardest part. And if we stick to it over time, it will become easier and easier. So this is what we're trying to achieve in the nervous system. So as a bit of a recap, pain is our body's alarm system for perceived threat. It's closely linked to our sympathetic nervous system, so our threat nervous system, that is our fight, flight, freeze. And when pain persists, the alarm becomes more sensitive. So when we have pain for a long time, we do have to treat the tissue or the injury or whatever originally started the pain, but we also have to treat the nervous system. When we focus on the tissue alone, we don't have success because when pain has been persisting, the nervous system is also involved. So the next few slides and the next analogies, they come from this wonderful little book. And so Why Pelvic Pain Hurts is a nice, simple read that breaks down pain and pelvic pain into really understandable and relatable information. So I highly recommend it. All right. So now let's think about the dilemma of the pelvis. So imagine you've got this new sharp pain in your thumb at work all of a sudden. So with our thumb, I'm going to look at it, I'm going to inspect it, I'm going to move it, I'm going to see if there's anything going on, maybe it's swollen, maybe it's inflamed, and then I'm likely going to show my coworkers and say, look at my thumb. And have you had something like this? They might tell me, oh yeah, that's happened to me before too, and this is what happened. And then once we've inspected it, we can feel reassured. Our thumb has passed this inspection. That level of threat is going to decrease, and that's going to help with decreasing the pain response as well. Now, what happens if I get a new sharp pain in my private parts at work? Am I going to look at it? Am I going to touch it and try to move it? Am I going to tell my coworkers about it? How can it pass the inspection test? So we see that with pain down there, the taboo of it can lead to more fear, more anxiety, more frustration. And this in and of itself can actually lead to more pain. So now we're going to use a measuring cup as an analogy. So let's imagine that our pelvis is a measuring cup. Now, if water is continuously poured in, it will overflow. And when the pelvic cup overflows, we have a pain signal. So that pain alarm starts to go off. So the information that fill the cup is information from the tissues, the organs, the joints, information from the area that's sending information through our nervous system up to the brain. And now there are things that can create and stock the fire under the cup. Things that as the fire grows bigger causes the water in the cup to boil and overflow, and can also turn on that pain alarm. And these are things like emotions and stressors and things like anxiety and fear, issues at work. And so when that cup overflows, there's an interpretation of threat, which leads to pain. So if the cycle of the cup filling continues, the alarm can become more sensitive over time, and we might start actually experiencing pain with things like going to the bathroom or having intercourse or even sitting. Sometimes even thinking about a movement can cause pain, and that just shows us how powerful the brain is. We're not even affecting the area, but just the thought of something can create that pain alarm. Now, some of you may have experienced that other parts of the body have started to hurt as well. The pain started in one area, and now this other area is starting to hurt. So we can think of it as nosy neighbors. Let's say my bladder was the original area that started hurting, and my bladder, let's say the alarm in my bladder was going on and on and on and on, and it wouldn't turn off. Now the areas, the neighbors next to the bladder, they might start thinking like, oh gosh, this alarm is going off. Maybe my alarm needs to go off. And then their alarms might start to go off. So if I started with bladder pain, I might start experiencing some symptoms of IBS, or perhaps my vulva might start hurting, or I might have pain in the uterus. And then the more those alarms go off, then the next structures might start to have that pain alarm go off as well. So sometimes we see pain spread in a way that doesn't really make sense to the original injury or the original tissue that was affected. The other thing that can happen is if there's inflammation in a part of the body and that inflammation is persisting, the structures next to it are also in that inflammatory soup. And so they might start having an inflammatory response and start experiencing pain as well. And so with those nosy neighbors, there are certain things that we'll be covering over the course of this group that can help break that cycle. Now, I'd like to bring our attention to what happens in our bodies when we're attacked. Right? So let's use the example of being attacked by a lion. So this is when my body is going to go into that fight or flight response. So my adrenaline and my stress chemicals are going to increase my heart rate. My big muscles are going to be ready to fight or fly away. My stomach, my digestion is going to be slowed or perhaps put on hold. My language will be more simple, like get away or run. My breathing might be faster and shallower. My healing might slow down, and I'm not going to be very concerned with something like sexual attraction. And so why do I bring up the lion? So for people who are living with pain every day, it's like they have a massive roaring lion following them around. Our bodies aren't very good at telling the difference between being attacked by a lion and other types of stress, like a deadline at work or the stress of persistent pain. Now, the thing to keep in mind is that our system is designed for short-term exposure to this stress, not long-term. And if we do have long-term exposures, there are certain things that can start happening as a result. We might start experiencing something like more tender areas, like mood swings, our appetite to change, fatigue. We're going to have difficulty sleeping, because how can we possibly sleep when we're worried about being attacked at any moment? Our stomach might become more sensitive. We might start having diarrhea or constipation, lower sex drive, decreased focus, and even depression can happen from prolonged stress response. So we're telling the lion to get out of here. We're telling the lion to take a hike. And how are we going to do that? Well, first, we want to stop filling that cup. So we're going to treat the area. We're going to perhaps do some exercises that could be helpful to the area. Maybe some breathing strategies, the manual techniques, ways to connect to the area and get it to relax. Now we want to get rid of that fire under the cup. So this could mean using strategies like cognitive behavioral therapy skills, perhaps things to decrease stress, the mindfulness techniques. And so we're trying to break this cycle. We're trying to stop filling the cup. We're trying to put out the fire, and we're trying to break the pain cycle. And the pain cycle looks like this. We've got sore tissues. We might experience some fear and worry about those sore tissues. The body is going to tense to protect those areas, and that's going to worsen the pain. Now, it can be helpful to pick one area to work on to try to break the cycle. It can sometimes feel overwhelming to try to address everything all at once. So what exactly is our pelvis? So it's a bowl-like structure at the base of the trunk. And then we have different things that are involved, different parts of the body in this area as well. We have bones, we have muscle, we have nerves, we have fascia. And this all makes part of the pelvis. And it's got different functions. So the pelvic floor is the bowl of muscles at the base of the pelvis, and it helps support our organs. It helps control our ability to go to the bathroom. It has a sexual function. These muscles are actually part of our core, so they help with our core strength, and they help with lymphatic drainage as well. Now, this is a study I like to bring up where women who are experiencing pelvic floor tension were asked to rate their perceived pelvic floor contraction. And they had sensors put on their pelvic floors so that they could actually measure their contraction. And so they had them watch 4 types of scenes on the TV. They had them watch something neutral, that was the weather. They had them watch a violent scene, a sexually violent scene, and a sexually stimulating scene. And so the women reported that they thought they contracted on the sexually stimulating scene, but not the others. But in actuality, they contracted their pelvic floor on the violent scene and on the sexually violent scene, and not as much on the sexually stimulating scene. So this tells us a couple of things. First, it tells us that when we perceive something as threatening, our pelvic floor muscles contract. And second, and perhaps more importantly, we're not very good at recognizing that contraction. We're not very good at feeling it. So we contract when we experience threat, and we don't always notice that we're doing it. So we can imagine that if we're in a perpetual state of threat, that pelvic floor might be tense, 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 and that can contribute to pain as well. So here's a pyramid that we like to use for the management of persistent pain. So what you can see here is that the big part is the lifestyle changes and the things that we can actually do ourselves. Social and psychological support are next, and medication is that small little tip at the top. Now, one thing to keep in mind is that for studies on medication for pain, the medication is deemed successful if it reduces pain by 30%. So it's unusual for the medication to actually get rid of pain. If it reduces the pain by 30%, that's deemed that it's a successful medication. And you may have experienced that. You may have experienced that some medication does help, or some of you may have experienced that medication may not actually touch your pain. And so these are tools that we use to help with the management of pain. So this group focuses on self-management, understanding exactly how pain works, and we encourage everyone to be an active participant in their own pain management. Trying to be a detective in your own body so that you understand what helps with your pain, what makes it worse, what can you change, what do you maybe need some help with changing. Trying to make a plan, something that can help us move forward. So before we meet for our discussion, I'd like you to go over the following reflection and intentions, because we will chat about them as a group. So first, what about the information presented speaks to you? What makes sense? What doesn't make sense? Are there things that we went over that, that doesn't make as much sense to me? Can you think of any experiences that you've lived through where the pain you had didn't match the severity of the injury? Either more pain or less pain than you expected? And are there some self-management strategies that you're already using? If so, which ones? What has been helpful for you so far? Now we'll go over some questions together in person. And here are some references. And these are wonderful resources with a lot more detailed information about pain if that's something that you'd like to look into. Thank you so much. We'll be seeing you soon.